Hey guys, we're going to talk about IV infusions. So, whenever your patient is receiving an IV infusion, the nurse, CO, or doctor will give an infusion rate, and then there'll be a calculation that they do to determine the drops per minute. It's not your job to do the calculation, but it is your job to monitor the drops per minute. So, once they tell you how many drops per minute, it is your job to monitor your patient and ensure that they are receiving the prescribed drops per minute. This is important because if the infusion rate is incorrect and you're giving something like D10 or an IV cocktail, then maybe their blood sugar was low, but if the drip rate is too fast, then that's going to make their blood sugar shoot up. And then the IV cocktail will be discontinued. And then over time, their blood sugar will go back down. And it just becomes this big cycle of going up and down and up and down. And a lot of this can be avoided by ensuring that you have the proper drip rate going in your IV infusion. And the same thing goes for just administering regular normal saline or other fluids too. It's always important to have the proper prescribed drip rate. It's essential. Now, monitoring the drip and counting the drops per minute is very easy. What you're going to do is you're going to take a timer and then you're going to start it and count how many drops you see within 60 seconds. If the drops per minute are too low, as in you counted too few drops per minute, you're going to increase the drip rate. If you counted too many drops in the minute, then you're going to decrease the drip rate. Then, once you make a change, you're going to reset your timer and you're going to restart it. And now you're going to count again for 60 seconds to see how many drips you have. You're going to continue with this count the drops per minute, make an adjustment, and then count again to confirm again and again until you get the desired drip rate. For example, if the desired drip rate given to you by the nurse in charge is 10 drops per minute, then you would continue this time and count, adjust, and then time and count to confirm cycle again and again until you get 10 drops per minute. Remember to reassess blood sugar as ordered and reassess the flow rate frequently because this can change as the fluid in the Soloset changes and as the baby moves around and other things happen. So the fluid rate that you set can sometimes change, so you always want to reassess frequently to ensure you have the adequate, proper flow rate that will allow the proper infusion of fluid to your patient. All right, guys, that's it for this simple but extremely crucial skill. I hope it was helpful. I'll see you in the next one.